Gabe Howard, and I am excited to bring you another edition of NAMI Tennessee at Home Facebook Live. We do these every Monday, and people are thinking to themselves, how would I know that you do this every Monday? Because of the email list. All you got to do is go over to NAMITN.org, sign up for the email list. We send out about one a week, and we let you know about really cool things, like, for example, the Facebook Lives. You can also replay all of the previous Facebook Lives. There's advocacy information. There's information about programs that NAMI Tennessee supports. There's information about what you can do to help NAMI Tennessee and be a mental health advocate. And of course, you're all here because you're already mental health advocates, and NAMI Tennessee will definitely show you the way to be the best mental health advocate that you can be. All right, enough about that, except for one more plug. NAMITN.org, join NAMI Tennessee's email list. All right, well, enough about that. I am super excited to have not one, not two, but three super cool guests this week. And I'm going to go ahead and let them introduce themselves. Who wants to introduce themselves first?
Oh, I will. My name is Kim Rush King, and I'm actually working for NAMI Tennessee. I am the statewide crisis intervention team, or CIT, coordinator, as well as a project director for another CIT grant that we have. I'm glad to be here.
Well, thank you so much for being here. Who would like to go next?
I will. My name's Ken Searcy. I work with the Cookeville Police Department. I'm a major here for Support Services Bureau, and we're in the process of trying to establish a CIT program. We're hosting an upcoming CIT basic training toward that end.
Well, thank you so much, Ken, for being here. So I guess that's everybody, right? All right, no, I'm just kidding. Who would like to go last, but certainly not least?
Hello, everyone. My name is Candace Allen. I'm a senior director for adult intensive services at the McNabb Center. I have served as the CIT coordinator for Knoxville City Police Department, Knox County Sheriff's Office, and University of Tennessee Police Department for about 10 years.
Well, excellent. Thank you so much. And we have a super surprise guest that just joined in. Bill Davis, can you hear me, Bill?
I can.
We can't see you because your camera's off.
Well,
but
I'm working on that right now.
All right, we're working on it now. Well, when your camera comes on, we will ask you to introduce yourself so that everybody can see your pretty face, right?
They're going to be disappointed.
Well, we absolutely love your personality, so I think we'll make do. So welcome, everybody. Bill Davis is working on joining us. He'll be here in just a moment, and he'll introduce himself. But let's go ahead and cover some basics. CIT is one of those things that everybody's heard of, but many people don't know exactly what it means. I ask people all the time, have you heard of CIT? They're like, yeah, that's that police thing. It is true, it is that police thing, but let's get a better definition than that. Who would like to explain what CIT is? Kim, it's you.
Well, okay, that's fine. CIT is Crisis Intervention Team. It's actually a model that was developed in Memphis around and began in 1988. It is the Tennessee model. It is also around the United States and internationally. The CIT is all a program. It brings law enforcement, mental health, advocates, families, and people with lived experience, as well as other community partners together to really kind of help law enforcement in knowing the experience in a mental health crisis, and also for them to know the resources available to them. Because our goal is, hopefully through CIT, we definitely will reduce incarceration rates and get the appropriate, proper treatment for our consumers.
Thank you so much, Candace.
I think a lot of times people, they think that CIT is crisis intervention training, when actually it's crisis intervention team, because what you want is to train enough people in a continuum to where you have, law enforcement, mental health, AMR, hospitals, everyone kind of speaking the same language and being able to help that consumer as they navigate through all the different systems that sometimes they have to go through to get the help that they need.
I like the concept behind team. Now, a lot of people feel that law enforcement and people with mental illness, they don't connect so well. And I say, well, that's why we need the crisis intervention team. That's why we need law enforcement training. And what's interesting to many people is we think this is a new idea. We're like, oh, well, in the last couple of years, we've started to work on this. But as somebody said, I believe it was you, Kim, this model was started in 1988. This is surprising to many people because they think, well, if it started in 1988, what's taken so long? Would anybody like to discuss or address, are we moving forward? Is it better? I was not a mental health advocate in 1988, so therefore I don't know what it was like before CIT came around. But I know people are surprised that it's been around as long as it is, or it has.
Well, actually, yeah, go ahead, Ken. You'd be the perfect one to answer.
Well, I just started to say that there's, you see through law enforcement, it's like everything else. There's constant change going on. Unfortunately, a lot of law enforcement agencies are not too keen on that. They would prefer for change not to occur, but that's not possible. So, at any rate, over a period of time, more people have seen the importance of trying to improve our response to dealing with people who are in emotional crisis. And there's been a number of lawsuits that have helped kind of force this change in the way of thinking, to kind of look ahead and see how the kind of contact law enforcement may engage in at a time when a person may be in particular suicidal. The officer may be going to make contact with this person just to check on their welfare. It's been a big thing for law enforcement to try and change the training to look and see before you ever make that contact, what are the possible outcomes, to do some contingency training ahead of time. Well, in order to do that, you have to have an understanding of what kinds of issues you may be dealing with. In other words, you don't have to be a psychologist or anything, but you probably do need to know the difference of someone who may be suffering from paranoid schizophrenia, who is decompensating and been off their meds for a long period, threatening their own family members. So, at any rate, it's been a big push to make more communities realize it's more of an issue than they ever thought. Typically, it started with the larger agencies, aside from Memphis being the one to originate the program. Some years ago, as part of a drug court training program, I'd gone to Seattle, Washington, and I believe Seattle was the second city in the nation to adopt it. But they had had a tragic incident involving a homeless person with extreme mental illness, and so at any rate, following this grisly murder of a off-duty fire captain at a soccer field, they realized they had to do something better to prevent things like this from happening. And what was good for the consumer was good for the community. And I think an important thing, like Candace had said a minute ago, it's really important, especially in law enforcement, that we make it clear the T is for team and not just training. Many times in law enforcement, there's grant money, there's politically correct programs, whatever, that mandates some kind of training. And then that's it. You just get the training, check that off, you're done. This should be much more than that. Aside from training techniques and educating the officers, the establishment of a team to learn how to work together for the best outcome possible is huge. And really, that's where this thing really takes off, is all these different members coming together and getting to learn more about each other and who they can rely upon when they're faced with a specific problem.
Ken, thank you so much. And as those watching are now aware, we found Bill Davis. Lieutenant Davis, welcome. So what we did, we all went around and we named 5 things that we love, 5 things that we hate. We did the hokey pokey and we turned we all did it. So it's only, no, I'm just kidding. If you could just take a quick moment to introduce yourself, tell the folks who you are and why you're here, we would really appreciate it. And welcome. I'm glad you got connected.
Well, I'm glad I did. The camera was broke on here. You've seen my face now, so now you know why. My name's Bill Davis. I'm administrative lieutenant here with the city of McMinnville. I'm also our CIT coordinator. And I guess I'm here. We started a CIT task force a few years back, and what Ken had just touched on, we realized that there was a lot more, services and tools that were out there that law enforcement was unaware of, and we brought everybody to the table. One of the first, I guess, that's actually gotten every facet of the community at the table to try to discuss a problem that we all deal with, and try to find a resolution, because education is important to the community, because they're just unaware. Folks dealing with mental illness and what you can and can't do, and they don't understand why we can't just take someone to the hospital because they're standing there talking to a stop sign. It doesn't make any sense to them. Honestly, it didn't make any sense to me when I started, but through the last 5 years of being able to work with CIT, work with folks in the mental health field, it has actually become a passion of mine. I work with it daily, and love that you guys have invited me to here to be part of this.
Well, we are very, very happy to have you here. Thank you so much. So we've covered what CIT is. We've covered a little bit of its history, and we covered its goals. So let's do a deeper dive. One of the questions that came up, and I imagine that nobody knows the answer off the top of their heads, is there a CIT in Houston, Texas? Now, now, if anybody knows, you're more than welcome to share. But the reason I popped the question on the screen, does anybody know?
Yeah, there's actually a mental health department within Houston Police Department.
Awesome.
They've developed a mental health team.
Very cool. See, I did not think it. See, I've got to stop counting y'all out. I feel very bad. The reason that I do bring the question up. So one, yes, there is a CIT in Houston, Texas. But the reason I bring it up is because it's. I would have loved to just been able to pop it up on the screen and say, yes, there's CIT everywhere. Why? It's sort of like asking, is there a McDonald's in Oklahoma? I can just say yes. I don't have to Google. I know there is a McDonald's in Oklahoma. But CIT is not as prolific as McDonald's. Can we discuss, because everything that you're saying makes sense, and I'm thinking this needs to be everywhere, but it's not everywhere. Can we discuss some of the challenges to starting CIT programs, why they're not everywhere, and what are the barriers that the people watching can help their towns get over if they know that their city, town, municipality does not have a CIT program? I know, big question. I look for a lot of discussion here.
When we go around the state of Tennessee, establishing CIT programs within our counties, CIT is not even going to work unless your law enforcement agency, your police department, your sheriff's office, whichever one or both, are not on board. They're the first stop I make when wanting to implement or promote CIT in that county. Once I know that your chief and your sheriff is involved, then you have mental health and advocacy become involved. And that's the three-prong, really, when it comes to CIT. So anybody, I would strongly suggest for anyone to go to their police departments, go to their sheriff's office and ask them, are you familiar with CIT? What can we do to help you to bring in CIT for our county?
And I think too, Kim, to what you're saying, I think it has to be mental health approaching law enforcement with a respect that we're coming into your house, for lack of a better word, in that you've got to get a mental health center that is willing to dive into that culture and work with individuals and not come in with your own agenda.
I think that's excellent, Candace, because again, if law enforcement's not on board with it, it's not going to happen. And we do need to be respectful. And honestly, history tells us that our relationship between mental health and law enforcement has not always been positive. And so it's such a wonderful process to watch happen. When you do get that law enforcement department on board and you bring in mental health and whatever questions or they're not sure of each other is answered, and then they start pulling together. And next thing you know, we're developing this task force, and because we know that advocates are all about CIT.
Ken, I'd like to hear your thoughts because you're starting a CIT program right now. You're the baby in the room.
Sure, exactly. So what had happened with us is some years ago, we had considered it then, and I had went through the initial training for it and ultimately went through instructor training for CIT. And there was a push within the county to do some kind of collaborative effort between the hospital and the mental health service provider, and then the hospital went a different way, and so the idea just kind of died on the vine. And so it points to another thing that's critical is having that kind of support of your, governmental entity. For in our case, the city council, and not that anybody was necessarily against it, but there was no, monetary or business drive pushing it. And so lacking any kind of an outcry from the community or any kind of tragic event that focused everybody's attention, it just really didn't go anywhere. And the current council, of course, has been, very supportive of it, and in any kind of collaborative effort we could do, or co-response effort we could do dealing with mental illness, just because so many times you see some of the more god awful videos that have been released and posted on YouTube for the last few years will deal with people in crisis. And obviously, like we talk about all the time in tactical situations, right? If there's a SWAT call out, you have every kind of Johnny Commando you've got, and the fire department and the EMS and all the guys with scrambled eggs on their hats there. There's really only one person in control of the scene, and that's the suspect. In the case of a barricaded person, which is the single most common spontaneous type call out you'll get nationwide, if that person is now in crisis, he is in effect both your suspect and your victim rolled into one. And so it means there has to be a lot of effort placed into trying to do the best we can to respond. However, that person will drive the train. They will decide if they surrender, if they hurt themselves, or try to hurt someone else. So, at any rate, everybody has understood that proactive things that can be done to keep the community healthy, keep individuals when they're in a community healthy, helps us all.
Very good. And Lieutenant Davis, of course, you've been doing CIT for a number of years. What are your thoughts?
Well, I mean, I'm with Ken. I think it takes, unfortunately, for most places, it takes a tragedy to get this jump started. We were fortunate enough that didn't happen. Kim approached us about 6 years ago, about a class that was going on in Murfreesboro. And at the time, I think there was a couple of things in the media where folks had recently dealt with folks in a mental health crisis, and it didn't go well, mainly because they just didn't know how to handle the situation. So the council was been on board from the get-go, because we were able to sell the fact that spending some extra time with folks that are, one, not just acting that they care, they actually do care, and that they've got a good speaking ability to, as Ken said, when you get these SWAT call outs, you've got all the folks with tools. We just saw this was a great tool, and the guys can actually use it in their everyday walk, because, all the number of calls they answer, it's not just dealing with folks with mental health. It's just teaching them how to talk to people and finding a better way without having to put hands on, and then maybe understanding at least what they're going through, and put yourself in their shoes for a minute. And as Ken did point out, I mean, they're the ones making the choice, but I think sometimes without the proper training, without the ability to be compassionate and show them, because our body language, officers are, as Kim said a minute ago, talking about, we don't, sometimes you're in our house and things don't go well. Officers got an A-type personality, or we wouldn't be doing this. And we're supposed to be in charge. And as Kim says, that's not the case. And what you say and what you do means a lot. And this is some of the best training I've ever been to. I recommend it at least part for everybody, but not everybody can be CIT, and not everybody can do this job. And that's what Ken and myself come into play in our end, is picking those people who have a knack. They have the ability to talk to people in a crisis and not push them. Because, I've stood and talked to people for over 6 hours standing on a hillside. And it's hard to do that, because you run out of things to say, or you run out of things to do. And in the old school mentality was that we need to get this done and over with, to take enough man out. But that's just not the case. And I just think it's the best thing in the world. I enjoy it. And whatever we can do to help, we'll be.
Kim, I want to throw a question back to you because something that Lieutenant Davis said is that when Kim approached them, so you clearly got the ball rolling, or Lieutenant Davis's, I keep wanting to say team, but I am not law enforcement, but precinct. We'll go with precinct. That sounds right. I watch Law and Order. That's close enough. But sincerely, it sounds like, Kim, if you would not have approached Lieutenant Davis or his commanding officers, et cetera, and pitched the idea to them, Lieutenant Davis never would have heard of this or never would have gotten involved. And he's speaking extraordinarily highly of it. And I just couldn't help but notice that whole thing started because Kim showed up. What is that like for you? Just bang on the door and say, hello, police officers. I got an idea. How does that process work, sincerely?
Honestly, the way CIT spreads is by word of mouth.
Mm-hmm.
And I was very fortunate to actually start CIT in Rutherford County, and which is still going strong now today, and that's 10 to 11 years ago. But Warren County, along with several other surrounding counties, started sending their officers to that training. That's what opened the door. So when Lieutenant Davis and some of his officers from McMinnville went through the training, then he and I got to know each other. And after the training, he was interested in wanting to do something in his county. That's how it works. That's what's one reason why I love it.
Yeah.
And Kim, I want to keep you on this on that same track for just a moment. NAMI Tennessee will help anybody. Well, I mean, obviously, any police force in Tennessee that wants to explore this. This is you, right? How does somebody call you up and say, "Hey, come to my police force"? Do they just call you up and say it?
They can actually email me, and I can give you that email address if you would prefer.
Yes, please.
They can also contact me or call me, I guess. But the email address is krushking@namitn.org.
Say that one more time.
krushking@namitn.org. You could just access NAMI-TN's website and look under as far as employees or staff, and it'll give you my email as well. But that's what our job is. That's what we're wanting to do. NAMI is all in when it comes to CIT,
Mm-hmm.
and wanting to do everything that we can to assist law enforcement, because unfortunately, a lot of the folks that we deal with in the mental health world, law enforcement is their first entry into mental health.
Mm-hmm.
And we don't want that to happen. But as you hear these officers too, they don't want that to happen. So it's just a good partnership.
I could not agree more now. It's krushking@namitn.org, of course, where you can contact NAMI Tennessee. Many of you watching know how to get a hold of NAMI Tennessee. But if you don't, you could join NAMI Tennessee's email list and then just hit reply, and boom, it'll be right there. See all the advantages of the NAMI Tennessee email list over on NAMITN. I have to do that like 3 times. It's part of the, I signed a contract. Oh man, they're worse than Doritos when it comes to this. They're not messing around. Sincerely, thank you, Kim. Now, Lieutenant Davis, if we could go back 5 years ago, or 5 or 6 years ago, when you first heard about it, what were your thoughts? I mean, was this something that when they walked up and said, "Okay, we've got a solution to these issues that you're having. The community's getting bored. All you have to do is offer CIT." Were you like, "Yeah, that sounds reasonable," or did you have to be convinced?
No, I was not. It wasn't that easy. Actually, my boss says I'm kind of a hardhead. So if they can convince me it's a good thing, they thought I could probably sell it. And I kind of went, honestly, to begin with. I didn't know anything about it. What little bit I researched, to me, it was not what I was used to in law enforcement, and I didn't think it would work. And when I got down there, I was one. And Kim will tell you, a lot of the officers that show up, if you don't handpick them, they don't volunteer, and they're forced to go. They'll go with the anticipation they're going to prove you wrong.
Mm-hmm.
And that was probably me to begin with. after a couple of days of listening to what Kim was teaching on the Memphis model, and then once we started into the role playing and seeing how well it worked, I fell in love with it. And I came back at that point. That's what changed my mind. I came back and said, hey, I think this will be a tool we can use to stop injuries, stop hurt. We won't hurt anybody else. It may take a little longer. It'll work. And from then, they said, well, good. We're going to turn you into the CIT coordinator and see what you can do. And we've developed a pretty good task force, and I love it.
I like what you said there about everybody comes to prove it wrong. As I do a very small part in CIT, it takes me about 2 hours of the overall 40. And I swear when I walk out there, all the police officers look at me like, who the hell is this idiot? And
I think that I agree that, not that you're an idiot. No.
Good save.
I agree, though, what you're saying, because I think when we start teaching that first day, because I do the first part like you do, Kim, the mental health overview and all that. So it's like, you're looking at the audience and it's like, So, and I think there's a lot of people questioning. Some people, really didn't sign up for it and so forth. But what is so gratifying is that, and I'm sure you've experienced this too, Kim, like on Friday, people will come up to you and say, listen, I thought this was just, I won't even repeat what they say, but, and then by the end of the week, they see the light bulb goes off and it's like, this can help us. It is another tool. You can't use this training in every single, call that you go on, but when you can, and when you can divert, it works. And so I just love it when you go from Monday and those looks that you get sometimes. And then on Friday, they come back and just with a different perspective and a willingness to try it. So it's really something.
I'm sorry.
Go ahead. No, please.
As an instructor in this too, as she just said, by Friday, and what's even better than that, I've had them call me first of the week and say, hey, by the time I got home, there was a situation that required what you taught me and the scenarios and how to do it. And we normally would have had to use deadly force in a situation. We were able to talk them down. Life was saved, and no one was injured. No officers were injured. None of our folks were injured. And to me, that tops the whole thing. And if you can if other departments know that this is something that you can do to keep your citizens from getting hurt and your officers, it's just great.
Well, Memphis, has actually tracked the data for so many years, ever since they started this CIT model. And it shows every year, using this, officer injuries and then the suspect injuries are amazingly reduced. And that's what we talk about when we engage in the 40-hour training. It does not usurp any type of officer training that they've had. It's another tool to assist before we ever have to get on to that use of force or hands-on like Bill was talking about earlier. But I'm in agreement with Candace. That's what's so gratifying for me at the end is when you have officers, and then I'll have them text me, email me, or call me the next week. I had to use it Saturday, and it worked.
It worked.
That's not exactly the way they say it, but it works. So they're just amazed.
One of the questions that came up, we have an anonymous way for people to ask questions. So unfortunately, I can't pop it on the screen. But one of the questions that came up is, why the heck are we calling 911 for mental health emergencies anyways? And I know that we all have sort of feelings on this, right? But I would like to hear from especially the officers. Why are we calling 911 for a mental health emergency? We wouldn't do it for a heart attack. I guess we would call 911 for a heart attack, but the police wouldn't come, right? So can we talk on that for a moment?
Ken, you
want to go first?
Yeah. Well, the really short answer and maybe flippant answer is to say, we call 911 for everything in this country. I mean, listen to the audios where the woman called because she didn't get her hamburger right. She calls 911 to complain. But truly, medical emergencies, I mean, my gosh, just like our department, we issue AED kits to sign out for every uniformed officer. With that, now we have Narcan, we have EpiPens, we have bag valve masks, because we know the officers may very likely, number one, need it to help themselves or fellow officers, but they may very well be the first one there. And so we end up being the first stop for about everything. And so let's say like some of the communities nationwide have said, well, we're going to reimagine the police and we're going to defund it and we're going to turn it into a public safety something. And we're just going to let, ambulance crews or social workers or somebody else go deal with domestic violence cases or people in mental distress. And I'm like, okay, well, how does this really work in real life in our community, which is not particularly violent, which is not, the head of the murder capitals of the world, like some of the other parts of the country. EMS does not go there, period. They do not come on scene if it is an overdose, if it is someone combative, it is someone drinking, till we get there. They will not put a foot in the door till we say it's okay, we being the police. So that's not going to change in some of these other places. So many agencies would probably tell you, if it was truly, if you feel like the police can't handle it, or it's a mental health issue that could best be dealt with by a trained social worker and a medical person, then call them. It's not a threat to say we're going to not have to respond to that call. But the reality is we're going to get the call. We for sure are. So what we want to do then is to put our best foot forward, try and have officers hopefully trained better to understand it. For our agency, we're a CLIA agency. We're accredited through that international organization, in addition to the state accreditation. And it forces a lot of change. It requires constant update of the policy manual and review of standards based on case law. And so through this process of change, we have to keep the training level up for our officers. We have to stay abreast of whatever changes there are in use of force laws. It's somewhat mind-numbing. But it has been huge for us then not to fall behind and end up having to find out the hard way through some tragic use of force incident that, God help us, was preventable. So we try and learn from sometimes the negative outcomes of others, and so that's definitely been true when it comes to ideas like co-response. And so ultimately CIT is kind of a first step toward that. We here have just found out that the local provider has received a grant to provide a co-responder, a social worker that would be housed at our department to respond for at least a 40-hour period of the week. So it's only partial, but still we're willing to try it. And what we're further looking for with NAMI and with their help was we're looking for a CAHOOTS program. And so that we sure enough have a dedicated team that is a social worker and a medical person, a paramedic or whoever, that would respond potentially by themselves. I mean, they would be on that 911 list. They may get the call by themselves if they feel it's safe enough. But if not, then we'll go too. But we want to make sure we can all work together. And part of being a CLIA agency, we did a thing called the ICP One Mind campaign. And so we provided mental health first aid training, which is an 8-hour program to all of our officers and dispatchers. Of course, we need to provide it again because you'll fall behind from new hires and changes of staff. But we want to make sure that we know enough that we can help in this process, that we can be an effective team member to maybe get the best outcome we can.
Gabe, if I could interject here also.
Can I just say goodbye to everyone? I needed to get off. Sorry, I had another engagement, but it was nice to participate with you all. I'll listen to the rest of it later.
Thank you for being here, Candace. We appreciate it.
Thank you.
Bye-bye.
What I was going to say was actually there is a new number, 988, that will debut around this time next year. And NAMI National, as well as NAMI Tennessee, is heavily involved in the development of that particular number. And what we're hoping is that number will reroute a lot of 911 calls when it deals with somebody in a mental health crisis.
I think that 988 number is going to change a lot of things, just because it would be nice to know up front if a mental health crisis is suspected. I agree with you, Ken. There is so much to consider when it comes to policing mental health. Is the person a victim? Is the person a suspect? I mean, and I think that mental health advocates are unwilling to admit that sometimes we're both. We are victims of our illness, but we're a suspect in victimizing somebody else because of it. And what do you do with that? These are the things that CIT are looking to address. Lieutenant Davis, I want to throw the question back to you. How do you feel about police being the de facto responders for people having a mental health crisis?
Well, I mean, it's not the best choice. When we got into law enforcement, that wasn't part of the training. It wasn't something that you looked at. But, as Ken pointed out, basically we are the de facto in a lot of these call outs, and it's a safety issue. That's what general public is saying, is when they call us, they don't understand that this is a crisis that someone's going through, that one is most likely harmless. It may be bothersome if you're at a restaurant and someone's standing out front using profanity, or, as I said a while ago, cursing at a stop sign, but it's not hurting you in any way, shape, or form. And as we've pointed out to our officers, there's in the TCAs for criminal offenses, you got to be knowingly breaking the law. You got to do something that that potentially you're breaking the law, so that you can actually be facing criminal consequences. And that's what we've explained to them, is that they're not doing anything wrong. It is not illegal to have mental health issues. Now, what we've done is that now when we're there, we try to address it as, you can't get away from the uniform because you are who you are, but you're there to help. I'm not there to put you in jail. You've not done anything wrong. You're not committed any criminal offenses. Now, you are bothersome to the folks that are around you, and we're going to need you to do whatever it is to make that go away, even if it's just changing locations, or if it's maybe finding some resources in your area that they can go to during the day, that will get them off the street with people that are dealing with similar situations that they've got. So, yeah, in the beginning, I didn't think, it's not right. A lot of the calls that we get in law enforcement are not what we should be doing. I think a lot of the problems we deal with in this country is because law enforcement has become the disciplinarian for everything from our kids all the way up to our adults. And it's really hard to change that image when that's all you are. You're the person in authority. You're here to hurt me in some way or shape or form. So now we've got to change the face, fix that. And I think CIT is doing it, and it did it when its foundation. And like everything in life, it's circled back around. And I think our generation can make this even better than it was. It's just getting buy-in from not only the officers, but the public at large.
How has the public responded to CIT when they hear about it?
Well, from us, it's real positive. I've had a positive. We get all the time, why aren't y'all doing something about the mental health or about the homeless population, which sometimes runs hand in hand, probably more time than not. But we've done that. We're able to explain to them about CIT, what we're doing, because it's automatically, well, what happened to that person when we called you about them yelling at the stop sign, and why did they not go to jail, or why did they not go to jail because they do this, and you explain to them. So I think it's like everything else, it's education. We failed to do that. Sometimes we don't understand. We think everybody around us understands what we're doing. So I honestly believe that if we just keep them informed, I think our group here in McMinnville has been extremely receptive of it.
Thank you so much. I know that one of the criticisms, and I'm putting criticisms in quotes because I don't think it's quite the right word. Maybe concern is a better word. But people think that the mental health community is saying, well, if you do something wrong and you have a mental illness, you don't have to be held accountable. So if you vandalize or damage somebody or hurt somebody, well, you have a mental illness. Oh, okay, no problem, go home. And I don't know how that message got started. We're not saying that at all. Obviously, the police officers in the room, have you heard that criticism from people that it's just like, oh, well, because he has a mental illness, he can say or do whatever he wants and you don't care? And if so, how do you respond to it?
Well, I think one of the concerns, like where we were talking about Kim in her role, reaching out to different agencies or being the point of contact for law enforcement agencies that may be interested in starting the program, it is the kind of mindset you might hear, especially, let's say, from people in law enforcement that have to be elected into that job, because their ability to be elected in the sheriff of our county is going to be a lot dependent upon public perceptions. If that community seems rooted in that way of thinking, then it may be a tough time to convince that agency to go forward. So I kind of think it's got things she may see, but again, it's going to vary from one community to the next.
Kim, oh, sorry, popped up the wrong person. Kim, you work with the public a lot. Have you heard this criticism before, and how do you get around? Now, I shouldn't say get around it. How do you address it so that people understand that that's not what we're saying?
It's something that actually comes up at every training I've ever participated, but and it usually comes up, and it's like CIT also almost gives them a pass for what they've done. And the reality is, and I say this every time, if they've broken the law, they're still going to have to deal with the consequences of whatever that may be. However, it doesn't mean we can't get them treatment as well. Because so many of the folks in the mental health world and our consumers, when they are involved in the criminal justice world, it's for a lot of misdemeanors. And so there's got to be something else we can do instead of to continually incarcerate. However, nobody is excused if a law has been broken.
I am with you, Kim. I'm very fond of saying we're not saying do nothing. We're saying do what works. And the example that I always use is that the way that you would redirect a 2-year-old is very different from the way that you would redirect a 16-year-old. And as we know, 2-year-olds and 16-year-olds often have the same temper tantrums. But there's just a difference in how you would handle it, right? At least I'd hope so.
Well, I think that comes into play too about the getting resources within your community. We know that drug courts work. We know recovery courts work. We also know that mental health courts work. So if you do have a family member or someone with lived experience that seems to have consistent interaction with a criminal justice center or a system, let's find out what else can we do to help them hopefully stay out of that system as well.
I am imagining that none of you have these numbers right off the cuff, but if you do, I've certainly been wrong before, even on this call about numbers that Kim has. She's a smart one. But one of the things that I always say is that this saves money. The incarceration is expensive. Recidivism, constantly going to jail is expensive. Police having to come to the same person over and over and over. Forget about all the ethical, moral, forget about all of those reasons. Let's just talk money. Is CIT cheaper for the taxpayer?
It is. And
Absolutely.
It's absolutely cheaper because in our case, a lot of the transient population we were getting here, we were dealing with mental health crisis that, with those individuals coming. So you're talking about a lot of, without the education and without the knowledge of CIT, they were getting arrested for misdemeanors, as Kim pointed out, which was filling up our jails. These people weren't able to make bond, or if they were put on misdemeanor probation. And unfortunately, without medication, and they're not going to seek the help that they should, They just either one don't make it through probation, or they just commit another crime, another misdemeanor. So after this program and the inception, and we were able to get the judge at the table, and a lot of this we're doing, by diverting it from a probation of the state or local probation to working out an agreement that they'll seek mental health treatment on their probably codependent, work with that, not have the fines and the cost and things that were involved, and those people are not coming back to our jail. And we were just in the process of trying to expand our jail by another 50 to 75 beds, which was a huge hit on the economy here, and it's not happening yet. The numbers are down. Of course, a lot of that could have been COVID driven, but we are not seeing those rearrest every weekend of the same people, and it's stopped that. And it's all attributed to the fact that we actually have resources other than sending them to jail.
Right.
We know where to send them. We know who to call. And with the folks that work with us with the mental health here, they're really good about coming out. And as Kim pointed out, there is grants that's going to move that one step further to have people 40 hours a week that will even have more things that are available that we still don't know about, that they can actually get help. So yeah, I think it's definitely cost effective if you use it properly, and if you, as Ken pointed out at the beginning of this, buy in from everybody, top down. If the judges and the district attorneys and public defenders and everybody aren't on board, then it's useless. But if you get all buy-in, you can save not only the people money, but then you get people help that actually need it. And jail's not where they need it. They'll not get it there.
I'm very fond of saying, obviously we're all in this for the moral, ethical reasons of helping people. I myself never would have been helped if I wouldn't have got the care that I needed, and that would have been a big blow to me, my family, all the people that I know. But it seems like you can get people on board faster when you point out that our current method is not only not working, but it's pricey. Is that? This question is probably for Kim more than anyone, but is that an advocacy inroad, just to say, hey, I can save you money? Do people listen better when you do that?
Absolutely. When I've approached and spoken with chiefs or sheriffs, money's going to come up, finances are going to come up, because just like talking, the first question I usually get is, how expensive is this program? And to be able to look at them and say, you know what, this is free. So there's no money coming out of your budget to have to implement this type of program. Same thing with the 40-hour training that we facilitate for these counties. That training is free to those officers that attend, and it's post-certified. But what's really fascinating, we have a Department of Justice grant right now, and it encompasses 8 counties, and Putnam is one of those counties. But what we've been meeting now for the last couple of years, a steering committee, and we developed a certain data form to be able to track data whenever a trained CIT officer actually responds to a call. And so one of our programs, one of the municipalities within one of our counties, they did the pilot. And so when we started looking at numbers, it's a very small sample of numbers, but between April and June of this year, there were 24 of these forms that were completed by CIT trained officers in this one municipality. And what the data showed us was the disposition. Out of the 24, only 2 were arrested. And again, it's small, but knowing that only 2 were actually arrested, there were several that was resolved at the scene. So we know it works. And we hope to continue to build on that data across our 8 counties in the region, and hopefully even across the state.
Now, Ken, you are, again, the newest member of the CIT family. So you most recently had to convince your, either whether it's superiors, your adjunct agencies, like Lieutenant Davis said, if you don't get the prosecutor and the judges and all these other agencies involved, it's not going to work. How did you do it?
Well, I think there's an inherent logic in it. Again, you do have to have buy-in up front, and it is, to my way of thinking, very much a proactive program, meaning the best way to resolve these kind of god awful barricade situations where you have a person in crisis, in effect holding themselves hostage, and pulling out all these resources and using how much time and effort to try and resolve that thing. The best way to deal with that is to avoid it ever happening in the first place, to deal with people early on initial contacts, get them referred to some kind of level of care to deal with their root problem and not just treat the symptom. Inherently, putting people in jail guarantees failure. And what I mean by that is, just like our local jail, the best intent, everybody there, way overcrowded, and literally does not even have the physical space to provide for much to go on there in terms of kind of treatment while they're there. If the person is only there as a pretrial detainee and just subject to a bond, they're not even there for long enough to do much of anything, maybe make a reference, right? But they really just don't have the ability to provide any kind of true mental health services. And so to put that person in, let them make bonds, sign their own, whatever they do, if you've not changed it, you're guaranteeing they're just the same thing's going to happen again, possibly just getting worse. And so it's right off the bat, you can just see that doing the same thing the same way and expecting a different result is just illogical for sure, right? And so for us, truly, in all honesty, the people who were directly elected, which is to say, not me, not the chief, but our city council. City council was easy buy-in. The city of Cookeville owns the hospital here locally. We've always been, as a community, been very proactive with things involving community wellness, health-oriented things. Being one of the best places in the country to have a heart attack, by the way, you're most apt to survive here. But so they were, even those elected people, like right now, one's a doctor, one's a physician's assistant, both affiliated with a hospital. Any rate, another one on the board. So we've always been very close to anything related to, physical well-being. And so they were an easy sell. But let's say the DA's office and the sheriff's office. Well, these are people who have to be elected, and a lot is riding upon that perception of holding people accountable and responsible. So with the DA, he was a former police officer for us years ago, and so he comes from a law enforcement background, and he looks at things as a prosecutor would, as you would expect. When we were first joining for a pre-arrest diversion program with a local provider, it was a concern for him. But ultimately, you just wanted to be able to give them the tools to show them that logic of why not take the chance. In the case of a pre-arrest diversion program specifically, you've got someone that I could charge them for maybe public intoxication or disorderly conduct, or try and go to a center here that would have any number of health and mental health options to try and avoid just going to jail and coming out and doing it again tomorrow, because that's for sure what's happening with some of their frequent flyers, as we say.
Completely understand. Now, Kim, one of the things that you said earlier on that is just now catching my ear is that it's free. You tell the police stations and it's free. Okay. How is it free? Who pays for it?
Well, I guess there's many different ways to look at that. It's free to the department. Someone like myself and through NAMI and, our Department of Mental Health and Substance Abuse Services has been wonderful to work with too. And we're just all an advocate for CIT. And so we want to be able to provide this to our agencies across the state. So it's myself and a coworker, and that's what we do. We just want to travel. So I guess the cost of CIT is me. No, that didn't sound right. No, let's see. What would the cost
who
of
pays
CIT?
for it? It's paid for by the grant from TD-MHSAS, correct?
It's like I said, we've been very fortunate, and they've been great to work with. And then through our DOJ grant, our federal grant, then it's paid for. But what we're really proud of is no cost trickles down to these departments.
That is
what
exceptional.
happens. You're seeing that team effort already being displayed just in providing the training, because just like Kim talked about, it's a commitment on NAMI's part to provide her or anyone else to help with the training. It's some of the other different state agencies, service providers, local NAMI members, and so they're all starting to pull together. And basically, it's whatever they do currently as part of their regular full-time job or volunteer service, they do in the context of the training. So that's the only way it allows it to be done without cost. But
that sounded so much better, Kim, than what I was saying. So.
I know that we're nearing the end. We only have a few minutes left. And one of the things that I think surprises people is that CIT was developed in large part by law enforcement. That's like the number one thing. They're like, okay, well, what tree hugger developed CIT? I'm like, as a police officer, well, no, social worker, right? No, definitely not somebody in law. No. Can we talk about that for a moment? Because that's a really big deal, because law enforcement understands law enforcement. And I really think this gets missed a lot in CIT discussions. I mean, we saved it for the end.
No, you're exactly right. When it started in the state of Tennessee in 1988, again, it was Memphis who actually created that model. And referring back to what Lieutenant Davis and Major Searcy have talked about, unfortunately, it did take some tragedies to actually get to that point to where the advocacy, local advocacy, which was the NAMI chapter, as well as the Memphis Police Department came together and said, you know what, there's got to be something different we can do. And it was through the Memphis Police Department in conjunction with partners like the University of Memphis, mental health, advocacy, the mayor of Memphis at that time, all came together, and that's how CIT was created and began. But yes, mental health, it's written for law enforcement, by law enforcement.
I think that I do think it's incredible. I know that all the way back in 1988, and probably before, because these things take a while to get off the ground, I believe it was Sam Cochran, if I'm not mistaken.
That's correct.
In Memphis, Tennessee, worked with the local NAMI chapter, and obviously other community stakeholders that are probably lost to history. I'm sure that many people were involved. But the law enforcement piece is really important to getting that out there, especially getting buy-in from other law enforcement agencies. Because I know that I would, if somebody walked up to me and said, Gabe, I've never been a speaker, I've never been a podcaster, but I've got a plan for you. They're like, yeah, I'm paying attention. So I think that it is important that we let places that don't have CIT know. This was Mr. Cochran did us, I don't know his rank back then or now, but Sam Cochran was one of the big leaders on that. We got to give him a big shout out.
Absolutely.
Yes, absolutely. And typically, whenever I approach a department, that is the chief or a sheriff or the assistant deputy chief or sheriff, then I always do talk about that, because Major Cochran was instrumental. As Sam has said many times before, when all this came down in Memphis and they got this group together, and the mayor and them just looked at him and said, here, do what you want to do what you need to do. And he said, all of a sudden I was a CIT coordinator. And so, yes, it is developed by law enforcement. And that really is a message I do try to convey when discussing it with law enforcement.
I think
I'm a mental health person, so they're not listening to me.
No. I know we've got a comment. Sam Cochran equals tree. This is going to be like my moment where I get canceled. I can already feel it coming on. But sincerely, I know that people look for a reason to dismiss things, especially things that are new or that are unpredictable or that force us to change. And I want people to know that this isn't something that was just invented one day by a group of people on the outside looking in. There was many stakeholders from, there was mental health at the NAMI side, very, very important. But without Major Cochran, as you said, Kim, we would not be here today. And he's still out there pushing. I mean, it's not like he didn't retire. He's still around. Thank you to everybody here. Thank you to Candace, who's already gone, Lieutenant Davis, Major Searcy, Kim. We got to get Lieutenant Kim, Major Kim, Dr. Kim. Now, I'm giving you a title.
Honorary. I'm
honorary Kim. That's what we're going with. Thank you sincerely for taking the time. I know how busy all of you are, and this was extraordinarily educational, and I'm positive that everybody got a lot out of it. So the last thing that I want to say before we get out of here is the virtual NAMI Tennessee conference is coming up on September 23rd and 24th, and there will be a CIT panel. So you should absolutely check that out. You can learn more at NAMITN.org. Of course, if you already signed up for the NAMI Tennessee email list, you're going to get emails on it. So maybe that's another. It's way down there on my screen. I don't know where it is on yours, but you just go to NAMITN.org, sign up for that, and you won't miss out. Thank you, everybody, so much for being here, and we will see you next Monday. Wave bye, everyone.